So our last panel for today, I told you at the beginning, this would go really fast. It feels like it's going very, very quickly. But our last panel for today is a discussion about income supports. And these include items such as the federal child disability benefit, provincial supports, and lived family experiences of poverty and financial instability related to childhood disability. Tools at hand include the Child Poverty Report Card, the Market Basket Measure as it relates to disability and barriers to accessing things like the disability tax credit, what current federal initiatives provide opportunities or challenges for child disability initiatives. Our panelists today are Leila Sarangi, who is the National Director of Campaign 2000, a pan-Canadian movement working to end child and family poverty, and the Director of Social Action at Family Service Toronto. Just a reminder again that these fuller bios are available on the website. Our next panelist is Dr. Jennifer Zwicker, who is the Director of Health Policy at the School of Public Policy and an Associate Professor in the Faculty of Kinesiology at the University of Calgary. She's the Canada Research Chair in Disability Policy for Children and Youth and the Deputy Scientific Officer for Kids Brain Health Network. And rounding out our panel is Michael Prince. He is the inaugural Lansdowne Professor of Social Policy in the Faculty of Human and Social Development and an adjunct faculty member in the Department of Political Science in the Faculty of Social Science at UVic. Our moderator is again my co-convener, Brenda Lenihan, who is mom to a small son with health complexities. She runs BC Complex Kids and was appointed to the National Advisory on Early Learning and Childcare and the Ministry Advisory Council for Children and Youth with Support Needs in BC. Brenda, over to you.
Thank you so much, Amanda. I think I'm just going to jump into it and get this discussion started. We're going to start with Leila. If you want to start sharing your perspective and experience on this topic. Thanks, Leila.
Thank you, Brenda. And to the organizers, this has been such an incredible and incredibly important discussion all around and such a well-organized event. It's amazing. So thank you so much for inviting me to share my particular perspective. I'm also here to learn and grow about these issues. Campaign 2000, as was mentioned, is a pan-Canadian coalition of over 120 community organizations from across the country working together to end child and family poverty. We came about in response to a 1989 unanimous all-party federal resolution that passed in the House of Commons back in 1989 to end child poverty by the year 2000. So that is where we get our name from. It was a coalition of organizations that came together to try and hold federal feet to the fire around those commitments, because after 1998, rates of child poverty were increasing and were actually peaking by the year 2000 when they were supposed to have been eliminated. Family Service Toronto is a large multi-service organization that has been the backbone agency for Campaign 2000, providing all kinds of resources to ensure its longevity. And they do have a very large program for adults and children with developmental disabilities, so are really invested in the conversation today. We have been, since 1991, Campaign 2000 has been annually tracking, monitoring, reporting out on, acting as a bit of a watchdog on issues of child and family poverty. Our latest report card came out in February of this year. We not only look at the data that comes out of Statistics Canada, but we put forward community-driven, achievable policy solutions. Our latest report card found, and these are trends that we have been seeing year over year, continued significant high rates of poverty across the country. We're looking at data from 2020. There's a little bit of a lag in the tax filer data that comes out, but we prefer tax filer data because it's so broad. Anybody who's filed a personal income tax form gets counted in the low income measure that's derived from that data. So according to that data in 2020, still 1 million children lived in poverty across the country. The data, you don't get a lot of disaggregated data. You get some disaggregated data from that, but we also look to census data. There was a recent census release also from 2020 that continues to show significantly high, disproportionately high rates of child and family poverty for children from groups who are systemically marginalized. We heard earlier from Indigenous identified communities. So First Nation children living on reserve, living off reserve, Inuit children, Métis children have exponentially higher rates of child poverty because of ongoing experiences of colonization and systemic discrimination. New immigrants, racialized folks, children in lone parent-led families, particularly mother-led families, all have higher rates of poverty. What we don't have is good data on children with disabilities living in poverty. We don't get that from the tax filer data, and we don't get it out of the 2020 census data. We could probably buy it, but I think it's very expensive to buy this data. So we don't have it right now, but we know from, experiences like everything we're hearing today that there's such a deep connection there. And once we get the data, we know it's going to show disproportionately high rates. And we know the surveys that survey children 15 and older, or young adults with disabilities 15 and older, have disproportionately high rates of poverty. We have a policy platform that covers addressing systemic inequality, because as we've heard around intersectionality, it's so deeply embedded with experiences of poverty and manifestations of poverty. So our platform really addresses ending poverty by ending systemic inequality. We have recommendations around income security, around creating decent work, around public health, and well-funded public services like housing and childcare. We have put forward, and I think this is going to come back to discussions from earlier today, but we're really encouraging trauma-informed policymaking that relies on the principle that policies should do no harm. They should do no more harm to people in communities. And it should be developed with those who are most affected at the center of that policy development. I think sometimes our experiences get written off as, not technical, not real policy experiences, but communities, everybody here, we've been here and have the solutions for government to be able to implement. And that's really, really important to have that at the center of the policy recommendations. And that, as the last speaker was saying, to drive towards realizing our human rights and advancing obligations under the Convention of the Rights of the Child, the Convention on the Rights for Persons with Disabilities, advancing our human right, sustainable development goals, commitments, advancing the United Nations Declaration on Indigenous Peoples. And in terms of income supports, our report card also found that in 2020, even though 13.5% of kids, almost 1 million kids, lived in poverty, that was actually a historic low. And that was because when the economy shut down due to COVID, large swaths of the economy had shut down, the federal government stepped in a really big way and really quickly with emergency new programs, emergency benefits like the Canadian Emergency Response Benefit, and then one-time top-ups to existing programs like the Disability Tax Credit, like the Canada Child Benefit. And what we see in our report card, we have this line graph, and you kind of see poverty rates like tracking up here, pretty high, a little bit of a dip when the Canada Child Benefit was implemented. But in 2020, that line just dropped significantly, because what happened was those combined benefits, more than $102 billion, went to families and lifted those who are in our bottom incomes up. Now those benefits have ended. There's interactions in the way that they were designed. So those emergency benefits have interacted negatively with other existing benefits. Inflation has skyrocketed. So what we're seeing now, early data and modeling is we're seeing those poverty rates starting to increase. So I think the takeaway from what we learned in the last report card, we have the numbers that show that those kinds of income transfers, while we're waiting for things like available, inclusive, fully accessible universal childcare to be built, let's start by getting money into families who need it, so they can at least start meeting some of the basic needs without stress. So that's one of the things the last report card taught us. and making sure that they're accessible and available to people, like easy to access, like the SERB was very easy to access. So those are some of the highlights that I wanted to share today, and I'm looking forward to the conversation afterwards. Thanks so much.
Thanks so much, Leila. I just wanted to point out before we move to Jennifer is that we've actually shared the Menti link. We were going to wait till the end, but we've just decided we would start sharing that now. So if people would like to use that link to share their input, we are collecting all of that. You can also share in the chat while you listen. Or I'm not sure if you can share in the chat right now, actually, but you can definitely share in the Menti link. So we encourage you to do so. And Jennifer, we'd love to hear from you. Thanks.
Wonderful. Well, thank you so much. And I echo Leila's comments that, it's such a fabulous meeting, and it's been such rich discussion already. So, try to just really add to and emphasize a lot of the great points that have been made already in the conversation. I'll just acknowledge that I'm calling in from the University of Calgary, which is Treaty 7 region in southern Alberta, and is City of Calgary's home to the Métis Region 3 in Alberta as well. So just really privileged to live, work, and play on the beautiful land here. I guess I'll start off because I think the context for this discussion is around income supports and sort of policy. I won't go into it too far, but I would say just re-emphasizing the points being made about the UN Convention of Rights of Persons with Disabilities and the fact that Canada signed that, and provincial programs also need to be aligning with that. So I think when we think about policy, sometimes this gets a bit disconnected from how like the principles and the need to reduce barriers to participation in society, and then how we actually design and deliver programs and supports federally and provincially. So I think it's always a good guide to go back to UN conventions and think about that from a principles perspective. And I would say that because if you look at, and Leila's already gone through some of the data, like if you think about some of the data that we do know about, by and large, our programs just are not doing that, not meeting the needs of persons with disabilities. We know that. We know that from the Canadian Survey of Disability, that about 70% of persons with disability have daily needs that go unmet. About 40% don't complete high school, about 30% complete high school and post-secondary, and about 65% are not in the labor force. So mean personal income from the Canadian Survey of Disability is about $16,000 a year. So this is a reality from the population data. We've also heard a lot about the role of families and caregivers, and families provide over about 80% of support for activities of daily living. And people are reporting about 70%, again, of needs going unmet still. So, this is something that we have to kind of keep in context as a real important guide for thinking about better ways of designing programs and services to better meet needs and kind of meet those UN Convention commitments. So I think the piece I was going to talk about is around poverty measures, which is probably quite pertinent to build off of the points that Leila was making. So in Canada, we use the market basket measure. This is a measure that it's sort of a benchmark of poverty. There are a number of different poverty measures. And I guess the thing that needs to be considered as you're thinking about designing programs and benefits, because this poverty measure often gets as a benchmark for how you design benefits. So it's important that we know what that level is and how it relates to persons with disabilities. And so we've done some work using the Canadian Survey of Disability to look at this measure. And I'll just say kind of the take-home message is that it's underestimating the basic needs of persons with disabilities. So first and foremost, we know that persons with disabilities disproportionately have higher rates of poverty than persons without disabilities. It's about 42% higher. So that's, it's substantially higher. And the market basket measure, what it looks at is food, clothing, transportation, and shelter, and other goods. And so the thing that I think needs to be considered is that there are other basic needs that persons with disabilities who are living in poverty have that aren't captured by the market basket measure. So, this is something that we need to consider because just because we've perhaps raised income levels of persons with disability to the market basket measure, they quite likely are still experiencing the same impacts of poverty. So in particular, some of the areas that weren't covered were caregiving supports and housing accommodations and accessibility, and then accessibility, other accessibility supports like assistive devices. So just from a program design perspective, it's important to keep that in mind at a measure level. The other piece I was asked to touch on briefly in kind of opening remarks was around the disability tax credit. And I always find for this, I'm sure for this group, it's not a strange thing to talk about, but I think if you talk to international folks, it's very strange to talk about a tax credit. But it's such a cornerstone of the Canadian system right now. And we know that from data that about 30% is the uptake rate of people who we believe are eligible for the disability tax credit that are actually getting access to it. So, this is the story for federal programs like the disability tax credit, but it applies to provincial programs generally as well. Uptake rates of people who are likely eligible are much lower than you would expect. And so this gets to major issues with thinking about some of the design principles around some of these programs. We've from discussions and research we've done, some of the key things are really awareness is certainly a big issue, but also difficulties accessing programs. So complicated application processes, eligibility criteria that is complicated for people to navigate, and also the fundamental design of it being in the tax system requires people to file their taxes. And the other aspect that the disability tax credit is a non-refundable credit means that people who are lower income often don't see the value of seeking out the long process that it takes to get access to it, which leads to another point around not having the disability tax credit in Canada would have prevented you from receiving the disability supplement from the COVID supplement that occurred. It would have prevented you from getting the child disability benefit. So, these are the kinds of things that from a design perspective, it becomes quite critical. So, and unfortunately, we also know that the inequities are particularly strong for across some disability types, particularly mental functions. In some provinces, particularly Quebec, uptake rates are much lower. For Black, Indigenous, and racialized groups, uptake rates are lower. For lower income population groups, uptake's lower, and for childhood disabilities. So those are kind of the core groups that I think would deserve particular attention. So I'll just finish with saying that I think the way forward needs to be an approach that considers sort of a functional needs approach, and thinking philosophically more about an approach of trying to meet people's needs rather than being kind of this gatekeeper that's making people kind of run the gauntlet to access programs, and using that as a way to sort out who gets access and not. So your ability to navigate a system shouldn't be the determinant of who is getting access. So I'll finish there for now.
Thank you, Jennifer. Yeah, absolutely. There are so many barriers that both of you have spoken to, and it feels like our system is rather archaic and needs to be modernized. But of course, that's a slow-moving ship. We are going to now move to Dr. Michael Prince, and I'm going to give you the floor. Thank you.
Thank you very much, Brenda. And let me too echo my congratulations to the organizers and the participants today. Fabulous event and national discussion today and tomorrow. I too am calling in from Victoria, which is the traditional territory of the Lekwungen speaking peoples, today known as the Songhees and Esquimalt First Nations. And with much gratitude, I live on these territories as a guest on their unceded traditional ancestral lands. I was asked to talk a little bit about some of the current or recent federal initiatives as they pertain to income support. And And again, just building on Leila's and Jennifer's excellent comments as well, just to remind people that about 5 or 6 years ago, in life before COVID, in 2018, the federal government passed the Poverty Reduction Act. And with that, it adopted the market basket measure that Leila and Jennifer are talking about. So Canada now has an official poverty line, an official measure. We never had that. So going forward, conversations and debates can and should be guided by that very much, and has real implications for empowering family groups and other community groups and social planning organizations and advocates in framing demands, asks, human rights claims, very much informed now by the notion of we have an official poverty line at the federal level. And I'll come back to that in a minute with respect to the Canada Disability Benefit, which is going through Senate and Parliament right now. The next year in 2019, Parliament passed the Accessible Canada Act. And with that, again, it applies only to federal jurisdiction, but it adopted a more modern, inclusive notion of disability. So 2018, we adopt a poverty definition, fairly modern, fairly progressive, with limitations, as Jennifer pointed out, particularly for people with disabilities, but nonetheless an official measure. The next year, we adopt the Accessible Canada Act, which not only talks about intersectionality with respect to disability, it also talked about barriers. And as Jennifer's just said, and you, Brenda, just echoed it as well, it identified that policies can be barriers, and that much of the systemic marginalization Leila is talking about is really, it's in the programs, it's in the services, it's in the way we design and deliver programs that ostensibly are there to help people, but often they are barriers and hindrances, and can actually inflict harm and even traumatize people. So among the array of barriers that the Accessible Canada Act talks about, it does identify policies, programs, and service deliveries as places where we do know barriers currently exist, and in the principle of do no harm or future harm, that in any reforms going forward, be sure that we do not have any unintended consequences to exacerbate or create new barriers. A couple of years ago, the early learning and childcare agreements were signed and launched. Now, this focus on provincial jurisdiction and day program, not day programs, childcare spaces and programming. About $30 billion of federal monies over the next 7 or 8 years. About $3 billion of it directed towards Indigenous organizations, communities, $27 billion to the provinces and territories. Now, as many people will know who are participating today, some of the principles informing those agreements are about accessible and affordable and adequate, but also inclusive. And there is language in the agreements about recognizing how to support families with children with what they call varying abilities. That's the language in those agreements, but it was a really key consideration by disability groups to make sure there was some recognition that there are barriers within our early learning and childcare systems, and we need to pay some particular attention to how to enhance inclusion and access and adequacy for families with children with an array of disabilities. Just quickly, a couple other 2 or 3 things that have been meaningful developments. One was the Pay Equity Act that was passed by the Government of Canada a few years ago. This is to address gender gap wage discrepancies. Again, it only applies to federally regulated businesses and sectors, but it's a significant acknowledgement of trying to help support families, working families with children with disabilities, I think. At the very end of last year, in December of 2022, the employment insurance sickness benefits were expanded from 15 weeks of maximum benefits to 26 weeks, which many groups, including myself, have been calling for many, many years. And the federal government also introduced 10 days of sick paid leave, effective as of the end of last year, beginning of this year. Now, again, those apply to federally regulated sectors and businesses. So while these are positive federal initiatives, they often only relate to about somewhere between 7 and 10% of the Canadian labor force. And it's also, and if you are in the labor force, you have to have the labor force attachment to be eligible. So those are positives, but they're steps forward. Looking, I just want to talk briefly about the Canada Disability Benefit. Now, why would I mention it on a panel on childhood disability? It's a benefit targeting working age adults with disabilities. So it's presumed to apply to people ages 18 to 64. But I want to just, a couple things it's triggered. One is, well, what about the people who are under 18, and what about the people who are over 64? In the groups that have appeared before the House of Commons Committee and more recently the Senate Committee looking at this bill, there's been a lot of attention paid to seniors. And well, what's going to happen to someone who, when this benefit's introduced, they hit 60 or 65, assuming this is a substantial income supplement benefit that will help people who are currently on other programs, lift them out of poverty. This benefit ends at 65. Do they just go on old age security and guaranteed income supplement? Are they going to fall in terms of their financial security that they've been experiencing for many years? So there's been a lot of attention on that. Ironically, the poverty rate among seniors is far lower than it is among younger people. And it's been kind of a lost message here by senators. I get it, senators are older people and they're thinking about their own peer group. The message that didn't come across loudly enough was, well, what's the impact of relation between a new Canada Child Disability Benefit and the Child Disability Benefit, or the Disability Tax Credit and other benefits targeted at families with children and youth under age 18? There's been hardly any discussion of that within the parliamentary arena. And now, Minister Carla Qualtrough, is aware of these issues, but she's saying, well, I want to get this program in place first, then we'll get around to those other ones. What I find even more puzzling is that a Liberal Party promise to double the child disability benefit made several years ago has remained on the sidelines, forgotten. Now, I'm wondering whether they're waiting so once this new child benefit for working age is introduced, that they will then start to figure out how other programs interact with it and what to do in terms of the inequities that are inevitably going to be generated by a new income supplement for working age, but no new investments for families with children and youth with disabilities. So that's kind of a watch your space. If I've just got a minute left, Brenda, I'll just quickly, one thing that's been very interesting around the Canada Disability Benefit is the bill is what's called a framework piece of legislation. It's very skeletal. There's most of the details will have to be developed in regulations after the bill becomes law. That triggered a lot of concerns for groups that appeared before the House of Commons Committee last fall. And one of the things groups said was, well, there's really no definition of adequacy in this bill. This could be, the regulations could establish a benefit worth $1 a month. Like, there's nothing in here that really, other than nice words in the preamble about addressing financial security and tackling poverty. So the House of Commons Committee did amend the bill in 2 or 3 ways. And one of the ways they did was they added some language saying, well, when the government is deciding on the program design issues that Jennifer talked about, all the details that you have to think through on what the benefit amount will be for the new Canada Disability Benefit, the government must take into consideration the official poverty line as stated and defined in Section 2 of the Poverty Reduction Act. So that's the first time now a parliamentary committee said, okay, you're right, we now have an official poverty line. Let's put that in the language of the law. Now, what's interesting is it's come to the Senate and groups said, that's not good enough. And as Jennifer said, we know that the poverty line, the official one, doesn't capture 20, 30, 40% of the actual costs of families and individuals living with disabilities. So a number of us said, you've got to expand and improve upon the language that the House of Commons did, going beyond. And here's the amendment that came, and this is just out from yesterday. The Senate tabled a report, which will now be debated next week on the floor of the Senate. So it's not a done deal. So you might want to contact senators and say, please pass these amendments. But they've taken this amendment and said, not only should the benefit take into consideration the official poverty line, it should also, and it adds 4 other things. One is the additional costs associated with living with a disability. Now, if this passes, this will be the first time in law, in the federal level, that's spoken to. The next one they add is the challenges faced by those living with a disability in earning an income from work. So again, that's a really important piece of this is that, and then next is they add, and to take into consideration the intersectional needs of disadvantaged individuals and groups. Now that language was in the preamble, but what they're trying to do here is embedded in the core of the law to say, well, when the cabinet is deciding on the benefit amounts, or in the future, how they should be raised or improved upon, they must, as a matter of course, not only look at the poverty line, but intersectionality. And the final one is that the government needs to take into account Canada's international human rights obligations that Leila talked about and Jennifer. So that's a wonderful package of about 5 criterion for a lens now to start talking about what do we mean by adequacy in this country. So fingers crossed, this amendment gets adopted by the Senate. The bill will then have to go back to the House of Commons, and the House of Commons will have to vote on and accept, hopefully, 5. There's 5 amendments the Senate is proposing. We'll see if they pass the Senate next week. They'll have to go back to the House. The concern by a lot of disability groups is time is running out close to the summer recess. Will this bill pass and get royal assent before the summer? We've been here before where we had a bill and there was a snap election and the bill died. So a lot of disability groups are struggling around past the bill. But on the other hand, these are profound amendments that really would signal a much more favorable and I think hopeful future. And if this passes, then when we talk about the child disability benefit and others, we'll have this new language in law that really, I think, changes the game. So although I'm frustrated by the slow pace of change on a lot of things, I try to find the silver lining in the clouds. And this could be a really significant new development in the way groups and families and researchers like Jen and I approach and talk about, and Leila in the advocacy, informing Campaign 2000. This really could be a very significant new development. And I'll stop there. Thank you, Brenda.
Thank you so much. I appreciate that update. I have not been quite keeping up with it in the last few days, but that's
you've been busy.
that is really promising to hear that. And yeah, there's a wealth of knowledge here. You know, we've really talked about a lot of the barriers and a lot of the current state of what's going on with benefits. And I guess I wonder if now maybe we don't have too much time left, to be honest. We have a few minutes, but if maybe each of you could take a minute, pretty close to just a minute, and maybe talk about what you see in other jurisdictions that you would like to see happening here, or maybe not other jurisdictions, but just what do we need right now in terms of possibly targeted basic income, caregiver benefits, or working with the child disability benefit that already exists. I'll start with Leila. Thank you.
Thanks so much. And yeah, I also appreciate that update, Michael. I will just say hesitantly around the market basket measure is that it uses a very, very small survey that doesn't include people who are living in institutions, a lot of people with disabilities in congregate settings, in group homes, kids in foster care, anyone in institutions, in hospitals. It does not account for anybody living in the territory. So thinking about what we heard this morning. So as we're thinking about what else needs to go in that basket, those additional expenses for Northerners, you know, it doesn't include anybody on First Nation reserves. So the experiences of Indigenous people, First Peoples are completely erased. So while it's great that it's legislated, Campaign 2000 has actually been advocating for the use of tax filer data, which is broad, inclusive, and uses a relative measure, the low income measure that asks, not only can I afford my basic needs, but can I afford the same opportunities as my neighbors, as other people in our society? And to me, that's the crux of the human rights conversation. But I think, Michael, I totally agree that there is so much value and opportunity to have what does it mean to not be in poverty legislated in other frameworks throughout, and how you really start to advance that, because I think the goal is the same. Just wanted to lay our some hesitation around the market basket measure and how it gets calculated. And then in our report card, maybe the link will go or has been put in the chat, but we have a graph that compares the poverty rate from the low income measure and the market basket measure. And there's a 50% discrepancy. So the threshold is lowered, and the number of people that are considered to be living in poverty are about 50% lower when you use the market basket measure. So just a note of caution very quickly on what I think we need. We need a CERB amnesty. So anybody who's gotten those pandemic benefits, the federal government is doubling down and going after people to repay now, 3 years later. I've actually heard from a lot of people who have disabilities who have been, pursued by the government, asked to come in for appointments that they just, physically are unable to make, being put on payment plans that they just can't afford. We need to, stop chasing these folks for repaying those pandemic benefits that we know were so critical in those early days of the pandemic. We need to make sure that income security programs like the disability benefit and the current Canada Child Benefit are available to everybody. There's barriers for certain groups to access those benefits. Right now, Canada Child Benefit is tied to arbitrarily to immigration status. So if somebody can be here working legally, but waiting for the federal government to make a recommendation around their immigration status, and it can take years, and they may even have Canadian-born children. They're working, they're paying their income taxes, and they're not eligible for the Canada Child Benefit. So we need to make sure that those unintended, oftentimes arbitrary policy barriers are not there. And we've got a bunch of those in our report card that we've been putting forward to the federal government. And then thinking about what other jurisdictions are doing, the other program that we're recommending and piece of research that we're recommending is for non-tax filers. So how do you broaden the income tax system and through community-based clinics and going into First Nation reserves and working with people and getting them into the tax system, but it will never be universal. There will always be people with mental health issues, no fixed address, expired SIN, distrust of federal institutions, whatever the reasons. So how do we create a parallel income eligibility and distribution process? We have tons of informal community-based programs like that throughout Canada. And there are a lot of formalized programs all across the country, all across the world, in lots of different jurisdictions that have been evaluated and shown to reduce poverty for very marginalized, very rural, remote families, mothers, and children. And so how do we create research and create a parallel distribution system for people who will fall outside of our personal income tax system? Thanks.
Thank you for all of that wealth of knowledge there around the barriers, Leila. We are very short, we're essentially out of time, but I'm going to just invite Jennifer to finish off for us if you have any final comments to add.
Sure, just really briefly, I think two things that, and I think Michael's context was so important. And as we move into the actual implementation and delivery of something like a disability benefit and other programs, I would just say that we need to take more of a functional needs approach, moving away from kind of diagnostic driven eligibility, which is kind of what dominates a lot of provincial and federal programs currently. So, there are examples internationally where, there's another layer on diagnosis that gives understanding of functional needs, which is, I think, the direction we have to go. Unfortunately, that's going to require kind of development of new criteria, I think. So that's not necessarily a fast process, but it's a super important process to go through. On the point on caregiving, I would just say, and a shout out to a postdoctoral fellow that works in the group, Stephanie Chipper, who's on the call. There's a lot of private insurance and court litigated cases where damages are awarded to families, and they can provide care and compensate family members for provision of care. So there's a lot of inequities between how we design public funded caregiving supports relative to kind of court litigated cases. And so thinking about sort of the disconnect that happens between how we often don't allow family members to be compensated for providing care, I think fundamentally needs to be addressed in sort of caregiving policies going forward.
Thank you. Yeah, that's interesting and an area I wouldn't have thought to look when I say to look to other jurisdictions, but even within our own system, we should look to those kind of cases and see how that is impacting is when they are able to get a more holistic support package and do things in ways that work for their family. We are really over time, and so I think I'm going to have to wrap it up. I am so grateful to all of you, and I do hope that you'll join us after the conference. We will plan to have some more conversations like this and work towards recommendations. So I really hope you will all join us. Thank you so much.